I think that JP would be very proud of all you've achieved, Michael Patrick.
Well, that's very sweet of you to say, and I can only hope so, because I'm doing the best I can to rip off his act for the last 10 years. But, I mean, it's a good touchstone to remember, and one of the things that I like is the fact that he never took a stand politically. And too often when you listen to the radio now, you hear somebody's opinion all day long in your ear, complaining and griping and whining and crying, and it's more interesting to hear what your guests have to say than to hear yourself talk, because you're a genius till you open your mouth, is the philosophy I always went by.
Well, sometimes all of us can benefit from somebody facilitating a really good dialogue with 2 points of view that are articulate and that are well-spoken, so we can make up our own minds.
Well, very often it's not easy for people who go to the doctor to facilitate a conversation, even with their own doctor, because they get intimidated, or maybe they're afraid to ask questions, or maybe they don't know what questions to ask. And at Blue Cross, you've come up with a patient-centered medical home practice that really sort of bridges that gap, I think, doesn't it, at least?
It's tremendous, and it's really dramatically improving the healthcare experience for patients everywhere in Michigan, Michael Patrick. We started the medical home program back in 2009. We designated 1,200 physicians. A few weeks ago, we redesignated our latest group of physicians into the medical home. We now have more than 4,000 physicians in more than 1,400 medical practices designated across Michigan. It is the largest program of its kind in the country right here in Michigan. And Blue Cross is realizing significant improvements in health care. And those improvements in health care that patients experience are generating cost savings that are pretty substantial. In the first 3 years of our program, the cost savings were more than $155 million, primarily due to people avoiding emergency room visits because they can get in to see their doctor when they need to. And that's what patients want. They want access to their doctor, and that's what these medical home practices provide, with longer hours, electronic means of access like telephonic access, just more availability for their patients.
Yeah, that's the big fear, isn't it? That when you're going to need a doctor, you can't get a doctor, you have to wait a long time. And also, sometimes just being able to reach advice on the telephone is very helpful, and I know at Blue Cross you make that available too.
That's right, and the patient-centered medical home puts a great emphasis on making ease of access a priority for patients. Like I said, longer hours, telephonic access, email access, electronic prescribing, so the doctor and the pharmacy can identify potentially dangerous drug interactions, especially from people who take a lot of medications. That's a higher probability that they'll take two that don't work well together. And there's significant improvements in healthcare. The patient experience is better. We're saving a lot of money, and that's what patients want. They don't want to waste money in the system that drives up their insurance costs, and they want to have a great experience that makes them better as patients. And that's what Blue Cross is trying to provide.
bcbsm.com. You can go right there and use the Find a Doctor feature, and then you can locate the patient-centered medical home program that might be nearest to you and useful to you, and access 24 hours a day to your doctor's office, if you can imagine that.